Sympathetic supply of the thorax. The sympathetic supply of the thorax is derived from the thoracic part of the sympathetic chain. The thoracic part of the sympathetic chain runs on both sides, lateral to the thoracic vertebrae. The thoracic part of the sympathetic chain contains 11 or 12 ganglia. Each of these ganglia lies at the level of the intervertebral disc. Lies at the level of the related intervertebral disc. We all know that the vertebral column, between the vertebrae, there is a cartilaginous disc. Disc in between vertebrae, therefore it's called intervertebral disc. And each ganglion lies at the level of the corresponding intervertebral disc. The first thoracic ganglion usually fuse with the inferior cervical ganglion, as we see before in the sympathetic chain. In the cervical region, the inferior cervical sympathetic ganglion fuse with the first thoracic sympathetic ganglion to form this ganglion, which is called stellate ganglion, which lies in front of the neck of the first rib. What is the neck of the rib? Each rib has a rounded part like this. Therefore, it's called head of the rib. Below the rounded part, there is a constricted part. What is the constricted part below the head? Sure, it is called neck. And this is the neck of the rib. And therefore, the stellate ganglion lies in front of the neck of the first rib. This thoracic sympathetic chain begins where? The thoracic sympathetic chain begins as a continuation to the cervical part of the sympathetic chain in front of the neck of the first rib. Then the thoracic part of the sympathetic chain descend downward. Where? Descend downward in the upper part of the thorax, the sympathetic chain lies in front of the neck of the ribs. But in the lower part of the thoracic sympathetic chain, the thoracic sympathetic chain lies on the sides of the body of the vertebrae. Therefore, the sympathetic chain in the upper part of the thorax descend in front of the neck of the ribs. In the lower part, it becomes on the side of the body of the vertebrae. This is the body of the vertebrae and this is the side. The thoracic part of the sympathetic chain descend in front of these vessels and nerves. What is these vessels and nerves? These vessels and nerves runs between the ribs. We all know between means enter. Rib mean costal. Therefore, vessels and nerves runs in between the ribs are called intercostal nerves and vessels. There are anterior intercostal, lies anteriorly, and there are posterior intercostal nerves and vessels. Sure, the thoracic part of the sympathetic chain descend in front of the posterior intercostal nerves and vessels. The thoracic sympathetic chain ends by passing behind the medial arcuate ligament of the diaphragm. What is the medial arcuate ligament of the diaphragm? This is a view to the inferior surface of the diaphragm. We look, this is the diaphragm, act as partition between thorax above and abdomen below. And this picture is inferior view. This inferior view shows the origin of the diaphragm. The origin of the diaphragm, there are crus of diaphragm. This is called, these fibers called right crus, and these fibers called left crus. And on each side there are curved origin of the diaphragm. This curved origin called arcuate. Arcuate means curved. Arcuate ligament, medial arcuate ligament and the lateral arcuate ligament. The sympathetic chain end by passing behind the medial arcuate ligament here, just lateral to the body of the vertebrae, behind the medial arcuate ligament, to become continuous with the lumbar part of the sympathetic chain. What are the branches of the sympathetic chain? Branches of sympathetic chain can be classified into lateral branches and medial branches. This is the sympathetic chain on the side of the body of the vertebrae, and this is the intervertebral disc. And there are medial branches, which are visceral and vascular branches to the blood vessels and thoracic organs or abdominal organs. And these are the lateral branches. The lateral branches are the famous branches, which are communicating branches, rami communicants. We all know that each thoracic spinal nerve, the anterior primary rami of each thoracic spinal nerve is connected to the sympathetic chain by white ramus communicants, and white ramus communicants present only from T1 to L2. Why? Because this is the thoracolumbar origin of the preganglionic fibers of the sympathetic nervous system, and the preganglionic fibers runs in the anterior primary rami, and in the anterior primary rami, the preganglionic fibers leave the spinal nerve to pass to the sympathetic chain, and the preganglionic fibers are myelinated. Therefore, it is whitish in color. Then the preganglionic fibers relay or synapse in the sympathetic ganglion. From the sympathetic ganglion, the postganglionic fibers, which are non-myelinated, grayish in color, return to the spinal nerve in the form of gray ramus communicants. Therefore, these lateral branches representing the preganglionic fibers from the spinal nerve to the ganglion, and the gray ramus communicants representing the postganglionic fibers from the sympathetic chain to the spinal nerve. These fibers supplying the skin and the blood vessels of the upper limbs and the body wall. And sure, we all know that sympathetic fibers are vasomotor to the blood vessels, pseudomotor to the sweat glands, and pilomotor, which is the muscle which is the erector muscle of hair. These are the lateral branches to the skin and the blood vessels of the body wall and the upper limb. The medial branches are visceral branches. The medial branches are visceral branches to what? The medial vascular and visceral branches can be divided. Branches from the upper thoracic ganglia and the branches from lower thoracic ganglia. Branches from upper thoracic ganglia, these are postganglionic fibers. These medial branches, This is a lateral view to the thorax. We remove the lung, and this is the body of the vertebrae and the intervertebral disc, just lateral to the vertebrae, the sympathetic trunk or sympathetic chain. These are the lateral branches, communicating branches to the body wall and upper limb. And what is this? Medial branches. Medial branches from upper thoracic ganglia are postganglionic sympathetic fibers, which pass to the aorta and to the thoracic viscera through their corresponding plexuses. These fibers will form plexuses. What are these plexuses? These plexuses are from the upper 5 thoracic ganglia arise aortic plexus around the aorta and esophageal plexus. Esophageal plexus around the esophagus. Therefore, from the upper 5 thoracic ganglia, aortic and esophageal plexuses. Aortic plexus and esophageal plexus. From the 2nd, 3rd, and 4th thoracic ganglia. 2nd, 3rd, 4th thoracic ganglia. There are cardiac and pulmonary plexuses, which is supplying the heart and the tracheobronchial tree and the lungs. These are branches from the upper thoracic ganglia to the aorta and the thoracic viscera. Upper 5 thoracic ganglia gives the aortic plexus and esophageal plexus, sure to the aorta and to the esophagus. And from 2, 3, 4 thoracic ganglia arises cardiac plexus to the heart and pulmonary plexus to the lungs. Medial branches from the lower thoracic ganglia. Medial branches from lower thoracic ganglia represent the splanchnic nerves. 3 thoracic splanchnic nerves. Splanchnic means visceral. But these 3 thoracic splanchnic nerves actually doesn't supply the thoracic viscera. It descends downward to enter the abdomen to supply the abdominal viscera. What are the splanchnic nerves? This is lower part of sympathetic chain, and from the lower part of sympathetic chain arise greater splanchnic nerve, lesser splanchnic nerves, and least splanchnic nerve, the smallest, called least. Therefore, the larger is greater, the middle in size is lesser, and the smallest in size is least splanchnic nerves. These nerves carrying preganglionic fibers, not postganglionic fibers. It arises from sympathetic chain, postganglionic. Yes, these fibers are exceptional. The preganglionic fibers enter as white rami communicants to the sympathetic chain. But these fibers pass through the sympathetic chain without synapse to form the 3 thoracic splanchnic nerves to pass downward and medially in the body of the vertebrae. Pass downward and medially in front of the body of the vertebrae. And enter the abdomen by piercing By piercing what? By piercing the diaphragm. Piercing the crus of the diaphragm. Here, here this is lower part of sympathetic chain. I raise 3 splanchnic nerves, pass downward and medially, pierce part of the diaphragm called the crus of the diaphragm to enter the abdomen. First of all, the greatest splanchnic nerve. The greatest splanchnic nerve arises from the thoracic sympathetic ganglia, from 5th thoracic ganglia to the 9th. 5, 6, 7, 8, 9th. Therefore, the greater splanchnic nerve arises from 5 sympathetic thoracic ganglia. And these 5 is starting from the 5th ganglion, from 5th to 9th ganglion. And the fibers pierce the crus of the diaphragm to enter the abdomen, to end here, to end in ganglia around the celiac trunk. This branch from the aorta is called celiac trunk, and these ganglia are called celiac ganglia. The splanchnic nerve, the fibers of splanchnic nerve, end mainly in the celiac ganglion. But some fibers pass through the celiac ganglion without relay to reach the suprarenal medulla. This is the greater splanchnic nerve. Then the lesser splanchnic nerve arises from 10 and 11th thoracic sympathetic ganglion. Pierce the crus of the diaphragm, enter to end here, where in the superior mesenteric ganglion. This ganglion on the superior mesenteric called superior mesenteric ganglion, or in this ganglion. What is this ganglion? This ganglion lies at the origin of the renal vessels. Renal vessels which pass through the kidney. Renal vessels, and this is the aorta. The renal vessels arise from the abdominal aorta, and there is ganglion here called aortorenal ganglion because it lies at the origin between the aorta and the renal vessels. Aortorenal ganglion or aortico-renal ganglion. The least splanchnic nerve arises from where? From the last thoracic ganglion, 12th thoracic ganglion, and descend pierce the crus of the diaphragm to end in the renal plexus around the renal vessels to supply the kidney. We should notice that all splanchnic nerves descends medial to the sympathetic chain on the body of the vertebrae. All these nerves pierce the crus of diaphragm and enter the abdomen. The greater end in the superior in the celiac ganglion. The lesser end in superior mesenteric ganglion or aortorenal ganglion. And the least splanchnic nerve end in the renal plexus. The 3 thoracic splanchnic nerves, as we will see later on, in sympathetic supply of the abdomen, supply the abdominal viscera. Therefore, branches from the lower part of the thoracic sympathetic chain supply the abdominal viscera, not the thoracic viscera. The thoracic viscera are supplied by branches arise from the upper part of the thoracic sympathetic chain. The upper part of thoracic sympathetic chain, the upper 5 ganglia gives aortic plexus and esophageal plexus. Second, third, fourth gives postganglionic fibers to form pulmonary plexus and the cardiac plexus. Therefore, thoracic organ supplied by the upper part, sympathetic supply of the thoracic viscera from the upper part of the thoracic sympathetic chain. But the lower part of the thoracic sympathetic chain gives 3 thoracic splanchnic nerves, which enter the abdomen to supply the abdominal viscera. Thank you for good listening and good luck.